Well, hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical. I also am the owner of the Essential Health Medi-Spa, and I'm so excited to have Greg Nelson with us tonight. He's one of our orthopedic doctors, our orthopedic surgeons here in town. I remember when Greg Nelson came to town. That's how long I've been around. Or I was a nurse right around the time, because you said about 30 years, right?
Correct.
Yep. So, he was, at that time, the best thing since sliced bread, because we didn't have many orthopedic guys, and he came fresh on the scene, and he jumped right in and did a lot of sports medicine and took care of kids on baseball fields and soccer fields. And so welcome, Dr. Nelson. It's so good to have you here.
Well, thank you for having me.
It's great.
It's a pleasure.
Yeah,
Yep.
So you've been around a long time.
Well, this year will be, August will be 34 years
Wow.
since I came to Rocky Mount.
And you came alone, is that right? You
Came
started alone,
Yes.
and then you picked up Dr. McAvoy somewhere along the
That's
line.
right.
I'm not sure that
Yep.
he's been here quite a while too.
He's probably been 25, 30 years,
Uh-huh.
yes.
Yeah.
And now we've added 3 other younger partners.
Uh-huh.
We have Dr. Eddie Hasty, who's a trauma fellowship trained surgeon, and we have Dr. Ashley Strickland, who's a spine specialist.
Uh-huh.
And then we are fortunate enough to have my son,
That's right.
Dr. Clay Nelson,
That's
who's a
right.
sports medicine
Uh-huh.
orthopedic surgeon.
So he took after you with the sports medicine, huh?
He's way beyond where I was.
Oh.
Yeah,
it's-
he's way beyond whatever I could provide for folks.
Oh, well, let's just back up a little bit. So tell me where you grew up. How did where did you go to medical school? Let's take a little ride down memory lane here.
Well, I grew up in Ayden, North Carolina, which is
Oh,
a
okay,
small
you're a
town.
North Carolina boy.
Yep, between
Okay.
Greenville and Kinston.
Uh-huh.
And I went to undergraduate school at UNC at Chapel Hill,
Mm-hmm.
and then went to medical school at East Carolina.
Okay.
And once I finished medical school, I went to Emory in Atlanta to do my orthopedic training. And then after orthopedics, I came straight to Rocky Mount and started.
So you're
trying to work.
you're a homegrown boy.
Well, it does help being from North Carolina, because
Yeah.
when you see people in your office and they talk about certain things, you kind of know what they're
Yeah,
talking about.
yeah. I used to work with Ashley Parker, and he's from Roanoke Rapids, I
Yes.
think, and he went to Chapel Hill, and he's a local boy.
That's right. Well, Dr. Hasty's from Roanoke Rapids.
Oh, is he?
Clay, of course, grew up here in
Right,
Rocky Mount,
right.
and then Ashley grew up in Lillington. So they're all
they're all homeboys.
They're all North Carolina folks.
Isn't
yes.
that great?
So we're-
Except for Greg.
That's right.
Got to have one Yankee in every group, right?
Well, Greg was from Canada, and then he did his fellowship in Total Joints in Charlotte.
Oh, did he? Okay.
And we were sitting there, and all of a sudden he was looking at practices. He came, and probably the best thing that ever happened to me was when he joined.
Yeah.
And not only have we been partners for a long time, we're also best friends.
And I think that's awesome.
So,
that's great.
So he and I have been together for a long time, and then we're kind of on the back end of our careers, but we've got these young guys who are outstanding surgeons. I can't tell you how fortunate Rocky Mount and the area is to have the 3 young doctors that we
Yes.
have. I mean, they're
That's right.
top-notch,
Yes.
well-trained,
Yes.
and have great qualifications.
Yeah.
So we're lucky to have them.
And I'm on the referral end, and I don't think I've met Dr. Hasty, but I've met Ashley, and I've certainly met your son Clay. Actually, we talked about that Clay has been on my show.
Yeah.
He's a nice young man, very polite. You did a great job raising him.
Well, his mother did a good job.
Oh.
I may did a little bit, but his mother was responsible for all that.
She's the one that
That's
took
right.
care of those boys, huh?
And you will meet Dr. Hasty if you ever break anything. Hopefully you won't.
No, I don't want to break
But if
anything.
you have a broken bone, or you have a friend who has a broken bone,
Oh, he'll take care of it.
he's the one you want to see.
Okay.
Because I can tell you, my sister-in-law was in Raleigh. She fell off her porch. She thought she just sprained her ankle.
Oh.
Came down from Raleigh to see us, and she had probably 2 of the worst injuries you could have to your lower extremity. She had a calcaneus, which is your heel bone,
Yeah.
and your ankle fracture. And obviously, she could have gone back to Raleigh. Her dad is from Duke and already had several people from Duke calling. She stayed here. She had her surgeries, and she's made a phenomenal recovery for the type of injury she's had. And that's all because of Dr. Hasty and the therapy that she had here. And fortunately, her twin brother lives here too, so she could stay with him for a while she recuperated.
Well, that's good. Yeah, that's good. Wow. That's, well, Rocky Mount is really, we're really blessed, I think, with the caliber of docs. We have our cardiologists are great, orthopedics is great. We're, for a small community, sandwiched in between
Right.
Raleigh and Greenville, I think we can offer quite a bit for our folks around,
Well, that was one of the reasons I wanted to come to Rocky Mount, because, when I looked around, you had Interstate 95 and 64. At that time, there was the local airport was out here. You got a train station, and I said I just saw a lot of growth here, and it has grown because we're getting people from all over Eastern North Carolina coming for their care here.
Oh, yeah. Well, and Raleigh keeps moving this way.
That's right.
You can't afford to live in Wake County anymore, and there's not much room left in Wake County. So, Bailey and Spring Hope and those places are blooming and booming.
No,
And
it's going to be a big advantage for Rocky Mount because it's a lot easier to come east
yes,
than it is to drive against the traffic
that's
going
exactly
to Raleigh.
right. That's exactly right. So I can say, I've been in the medical field here for a long time and worked at Nash for 23 years before I moved over to Family Medical. So, I've seen it all. I remember very well, when the docs had to come and they were on call and they had to come in, and I'd call Dr. Nelson and say, Dr. Nelson, I've got a fractured femur. or no, he would never fuss. He'd say, great, I'll be right there.
Well, fortunately, you have people now that can do a lot better than what I did as far as taking care of femur fractures and like rotator cuff problems and ACLs. Like I said, we are blessed. I can't begin to tell you how lucky Rocky Mount is to have those my younger partners.
So you've got like a general orthopedic, is that kind of like a family practice? You're kind of a jack of all trades and a master of none, or how does that work? Because I know you said that Dr. Strickland does spines,
Yes.
and Dr. Hasty does the trauma, and Clay does sports medicine. So there's stuff in between, like got arthritis in your knee and you need a injection, to help
Right.
with the pain. So.
Well, fortunately, as my practice evolved, because like I told you earlier, when I came out of residency, probably 20% of people were doing fellowships, which is an extra year of training. Now it's probably 90% are doing an extra year. So like Dr. Hasty had an extra year of trauma surgery. Dr. Clay Nelson did an extra year of sports medicine. Dr. Ashley Strickland did an extra year of spine surgery. And then we have Dr. McAvoy, who does total hips and total knees, and he did a fellowship in Charlotte. So as it's evolved, they're kind of taking care of their areas, and Dr. McAvoy and I are doing the hips and the knees. And
Okay, so you're still doing surgery?
I'm doing some. I'm not doing as much as I used to because, like I said, we've got a new young man coming next summer. He's doing a fellowship in total hips and knees, and he's from Wilson. So,
oh my gosh, this is
not
awesome.
Not only will Rocky Mount have Roanoke Rapids because Dr. Hasty there and Clay here, and we're going to have him from Wilson. So we'll be getting people from Wilson coming to Rocky Mount for their care.
That's awesome.
So we're very blessed and looking forward. His name's Bo White, and his wife, I think, is from also Wilson. So we're looking forward to him
moving home.
That's right.
That's awesome. That is really good to know. So your practice is really growing.
It has grown a lot in the last 5 or 6 years, and I think a lot of that is us merging with UNC,
Yeah.
and we also have started, we got a little satellite office out in Middlesex.
Oh, do you? I didn't
Yes.
know that.
We go out there once a month, which as things continue to grow, we'll probably go out there more frequently. There's been talks of, us going to, they're going to build a clinic in Nashville. Whether that'll have orthopedics there or not, I'm not sure, but, so we have a lot
So
of.
UNC is
Yes.
building a clinic in Nashville? Wonder if they're going to have family practice. No, I'm just kidding. I'm pretty settled right where I am. I'm like you. I'm easing on out. We got to move the way for the new ones that
Right.
pass the torch on.
Right.
But yeah, well, I'm glad to hear that. It's hard to find. A lot of times, it's hard to find docs that want to come here.
Well, and you're true about that, because most of us, when we do our training in big cities. So, you get exposed to, restaurants, plays, things like
Sure.
that. But as I've tried to tell Clay, Ashley, and Eddie, there's something about Rocky Mount. Number one, I can go to Raleigh in
40 minutes.
40 minutes. But if I'm in Raleigh and my son has a little T-ball game at 5:30, I can't get from work to a T-ball game. But in Raleigh and Rocky Mount, I can be on the field in 15 minutes.
That's right.
And you cannot put a dollar value to seeing your kids grow up.
That's right. That's right. And you know that because you raised your boys here, and
Right.
And I don't remember if we told the audience, but we were talking earlier, and when I had Clay, your son, on the show, he told me, I said, well, what made you do that? And he said, my dad used to take me to the hospital, and that formed him when he was a young boy, that he wanted to do what his dad did.
Yeah.
I mean, I think it's awesome because he's a great surgeon. He's a great, person in our community, and sports medicine is big. We need it.
Well, he and his wife Julia have 3 little boys. And
You
so,
Nelsons don't know how to make girls, do you?
well, we got some girls, but they're in Georgia, grandkids. But there's a possibility there may be another orthopedic surgeon coming down the line after Clay.
Oh, okay. Well, that would be awesome.
That's right.
Just pass it on down
That's
from
right.
one generation to another. I think that's
Yeah.
awesome. That's
Yeah.
great. So I know that your office now, you have your own physical therapy there now. Is
Yes.
that right?
Well, they're not ours, but they're connected with UNC. So,
Okay.
And they're in our office, which is
Okay.
a big benefit because, if they have questions, used to either had to text somebody or call somebody. Now you can just walk over and say, do you mind coming over and just taking a peek and see? So it is nice to have them right there with us.
Yeah, and they're housed in the same building as you are?
Yes.
Okay. And how many physical therapists do you have?
Well, they have a lot because they have some at Nash Day as well. But in our area, I think there's 3 or 4 physical
Okay,
therapists.
Yeah, and that's a big part of, I know, hips and knees, replacements, you've got to have that physical therapy. And I also know it hurts, well, I don't know, I got both of my knees, I hope I can keep them, but, it can be very painful.
Well, it is very crucial as far as their recovery.
Right, exactly.
And, like a total knee, you have to go for some therapy. And, ACL, rotator cuffs, they have to go through some therapy. And that's just as important as the surgery itself.
Absolutely,
Because I remember when I was in residency, Dr. Houston, who's one of the fathers of sports medicine, he told me, he said, Greg, you can do a perfect ACL. And if they don't do their therapy, they're going to have a failure.
Wow.
He said you can do an average ACL, and if they work real hard with their therapy, they're going to be successful. And the thing about it is, as I try to tell, when I was doing a lot of sports medicine, they hear about all these professional athletes, and they get an MRI, and they have their surgery, and they recover, and they go back out and play. But as I tell moms and dads when they come in with their teenagers, first of all, they go to school for 6 to 8 hours a day. They got homework. They got their friends. If you can get them to do an hour or 2 of therapy every day, you'll be lucky. but it's very crucial for them to do it.
Yeah, yeah. I've heard that. Like I said, fortunately for me, I've got all my knees. Although I've seen Greg McAvoy several times, and he's, now Linda, you know it's bone on bone. Yeah, but I had some RPR.
Yeah.
Or PRP, I mean. RPRs, and it helped me a lot.
Yes.
So we're going to talk about that too.
Okay.
Because you do that, I'm assuming.
Yeah, our Dr. Clay Nelson is doing some of those.
Is he?
And it is very beneficial for arthritis. It's good for tennis elbow, golfer's elbow, Achilles tendonitis, patella tendonitis. Even some people are looking at it now for rotator cuff.
Are
When
they?
people have problems with their rotator cuff. The big problem is, I don't know if yours was covered by insurance, but a lot of them are not covered by insurance. And it is a big cost out of pocket.
Yeah.
But, hopefully eventually they'll see the benefits of it and it will be covered for folks.
I hope so, because it really, it just, if you can prevent surgery or hold off surgery like
Right.
me, and I've lost weight, so that's helped with taking the pressure off my knees, then, and I exercise every day, and that helps, you got to get those quads built up, right?
That's right.
So it all makes a difference, and people don't understand that. We're going to talk about that too in just a
Okay.
minute, but because I know that a lot of surgeons now, they want you to be a certain BMI before they'll do a hip replacement or a knee replacement.
Right.
And I think that's great.
A lot of centers are, if your BMI is over 40, are recommending getting involved with a weight loss program prior to surgery, because the complication rate in some studies is a little higher.
Oh, is it?
Blood loss, blood clots, infection.
Yeah.
And some communities have just come together and said, look, their BMI is over 40, we just tell them they can't do it. And even in Florida, I hear some of the insurance carriers will not cover it
Until
they get some weight off. So,
well, so you always take a risk when you go under the knife, and you
Right.
don't want to add more risk of throwing a clot or something.
Correct.
So it's amazing to me, because things change so much, and some days my head is just spinning because I can't keep up with everything.
Right.
My old brain doesn't go as fast as the latest and the greatest. But anyway, all right, it's time for our first break, and so we're going to take our break, and when we come back, we're going to talk to Dr. Greg Nelson about, I don't know, I gave him a list of things. I'm going to look over that. I think we're going to go back to that PRP. That's pretty fascinating to me. So anyway, hang on, watch our sponsors, and we'll be right back after these messages. Don't go away.
It's fantastic. He was different from everybody else I'd ever seen. He's compassionate. He really cares about his patients. I told him, you were my guardian angel. My experience with Nash was A+. So then the surgery I need here on out, give me a blank piece of paper, I'll sign it. I want you to do it.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Oh my goodness, I'm just, hello, welcome back. This is Here's to Your Good Health. My name is Linda Preziosa, and I've got Dr. Greg Nelson with me tonight, and we've been talking about some things during the break, and poor Lee's back there saying, "Are you ready?" And I'm totally ignoring him and not paying any attention to him at all. But anyway, so we're going to keep talking about orthopedic surgery. We're going to talk about joint replacements. I guess we'll go ahead and do that now, since that really is pretty much what you're doing now,
Yes,
right?
yes,
Is joint. So tell us about that. What joints do we replace? I know we replace knees. I know we replace hips,
Yes. Ankles,
ankles.
shoulders, and elbows.
Really?
Yep. Now, those are not as common. Obviously, the big ones are the knees, hips, and shoulders. Ankles, Duke has probably done as many ankle replacements as anywhere in the country. I mean, and elbows are not as frequent, but there are some joints that people have replaced as well.
So the joints in your elbow, is that maybe from an injury or a congenital problem or bad arthritis? What would be the reason for the elbow?
Well, obviously, arthritis is one reason, but most of them are probably traumatic arthritis from injuries that led to arthritis later on. And but hips, knees, probably are the most common surgeries that people do for joint replacements.
And we talked a little bit about the BMI. That's your basic metabolic index. Is that right? And it kind of measures how much you weigh. And people don't realize the pressure you put on your knees with all that extra weight.
Correct.
I used to know the numbers. I don't know them anymore.
Well, when you talk to people about their BMI, they really kind of want to know what their weight is, and it does have a big effect on especially the hip, knee, and ankle joint because you're putting all that stress on it. But there's also a lot of other things too that we're looking at now that we did not look at 25 years ago. We look at people's nutritional status.
Do you?
Yeah, their
That's
albumins
awesome.
and stuff, and see how well their nutrition is going in. Also, if they're diabetic, their hemoglobin and their A1C, we definitely like to have that less than 7.5. So if people come in 8, 5, 9, they're going to have to delay it until they get their sugars under better control because it increases the risk of infection. People who smoke.
Oh yeah, that's a big one, isn't it?
We put because it does interfere with the healing process, so we try to get them to stop smoking. But those are the things that, like I said, 25 years ago, we didn't know that much about, and we kind of tackled everything that came in. But now we're trying to optimize because most of the complications are rare, but if they do occur, they're pretty severe.
Yeah.
And can lead to additional surgeries, and sometimes they're don't have really good outcomes.
Yeah.
So you want to try to optimize those things.
Absolutely.
So we do a lot more of that now, and get involved with it, with their dietitians and with their endocrinologists and with their primary care doctors, and try to get them optimized prior to surgery.
That's awesome. And didn't you, I don't know if we said it, I can't remember what we said on air and what we said during the commercial, but some insurances now are requiring a certain BMI before.
Correct.
And it's all about the safety of the patient.
Correct.
It's all about getting the best outcome for the patient. You can go ahead and do the surgery and you're going to get paid, but we want that patient to be able to get up and walk and do and have the quality of life that they were looking for.
Well, it's also important for the physicians, and I know people probably may not believe what I'm getting ready to tell you, but I guarantee you ask any one of the 5 doctors in our practice, and I see people come in all the time and they'll have 2 scars on their knees, and I'll say, "Who you replaced your knees?" And they said, "You did, Dr. Nelson, 10 years ago." Well, you forget about these people after a while, because they did well. But if you have a complication, that person, you remember them, and it does affect you. And nobody wants to have a complication. So we try to optimize every situation
Sure,
we can.
of course.
Yeah.
And I get, now that you say that, I can see, why, I can just imagine if something did happen, it would haunt you, I'm sure.
Well, you have some sleepless nights, there's no doubt about that.
I'm sure, because your goal is to help people,
Well, that's why people come to see. I mean, people talk about advertising and all this. There's nothing better than a happy patient.
That's your best
That's
advertisement.
your best advertisement right there.
Yeah.
And it's like I said, they'll tell a lot of people, but if you have a bad complication, they'll also tell a lot of people. So,
Oh, yeah, yeah.
and there's none of us that are perfect. But,
Well, of course not.
But we all strive, and I think that's the wonderful thing about the younger guys and Dr. McAvoy. They all strive for perfection.
Yeah, you have to,
Yeah.
you have to. So we replace them and have the joints themselves changed? Has are they plastic versus titanium? I don't know anything about that. So.
Well, they have definitely changed over the years. You may have heard of people, I guess 10 years ago, getting metal on metal hips. They thought because the metal would survive longer. Because before that we were using metal on polyethylene, which is a hard plastic, and that was the weak part of the hip joint.
Okay.
And then we found out metal on metal was a bad problem.
Oh.
So we had to go back and rethink things, but the polyethylene, which is the plastic, has gotten a lot better. The longevity has lasted a lot longer, and we're using different types of metals and different type of components that hopefully give longevity
Yeah.
to the components.
Yeah. Everybody's always working and striving to get it to be a little bit better, aren't they?
They're constantly trying
Yeah.
to make them better.
Yeah,
Yes.
yeah, that's awesome. I had a question in my mind, and when it came in and went out just as fast, that's too many gray hairs, I think, on my part. But I don't remember. I guess we'll just move on.
Well, when you talk about like a hip and a knee, because, I've had people that I've done hips and then they'll come in and want their knee replaced. I tell them it's a lot different.
Is it?
A hip is a lot easier operation to get over, with success rate around 95%. A knee, no matter who or where you have it done, is about 85 to 90%. That means 10 to 15% of people, if you ask them at 6 months or a year, will say, I'm not sure, I wish I had my knee replaced.
I've heard that
It's
from
just
people.
a lot harder to get over and compared to a hip.
Yeah, is there more wear and tear on knees and hips, or?
No, I think number one, your knee is, you just touch your knee and there it is. There's not, your hip has a lot of muscle around it, a lot more blood supply. And I think the knee stays a little bit swollen. It's harder, it hurts a little bit more when you try to bend it. And then, of course, if they don't bend it, they can get, scar tissue and what we call arthrofibrosis, which is just a stiff knee. But it's just a harder, recovery for folks.
Yeah. And then hips, I remember Dr. Michael years ago, he had an anterior.
Yes.
There's an anterior way to go and a posterior, is that right?
That's correct.
And he was convinced that the anterior was a better surgery. I don't remember why he told me that now, but that was his surmise of the whole thing.
Well, I'm going to tell you my personal bias on this. Because anterior hips are the big rage. If you go to the internet and you're thinking about having a joint replacement, you're going to hear about the anterior hip because it doesn't cut any muscles.
Oh, yeah, maybe that was it.
Right. But, so you can do an anterior hip, posterior hip, or you can actually do it from the side.
Okay.
I was
didn't
trained to do
realize
a
that.
posterior hip, and I've done posterior hips. You have to do about 25 to 50 hip replacements to become really proficient. So if you're doing something, all of a sudden you're going to say, Linda, I'm going to do an anterior hip on you. You're going to be my 5th one.
Oh, yeah, okay, I gotcha.
All right. But when I had my hip replaced, and I had the option to go have an anterior hip or a posterior hip, I went to somebody who's a friend of mine who does a posterior hip, just like I do it, because I wanted to know what my patients went through. All right? So when he did my hip replacement, and I tell people the same thing, you'll get better 6 to 12, months. Well, I had my hip, and 10 days later, I was back at work
Really?
with a posterior hip replacement.
Wow, that's quite impressive.
Well, some of it is, when I'd go to work, I wouldn't think about my hip. I would think about the patient's hip. So my mind was not on my problem, and it did keep me up, and it kept me going. And so so I don't know that the anterior hip. Obviously, a lot of people have them, and there's nothing wrong with them. But there's nothing wrong with the posterior hip either.
Right. Well, the posterior hip's certainly been around a lot longer.
It's been a lot longer, yes.
It's a lot more time to perfect it than.
That's correct.
Yeah. So, all right. So, let's just kind of move a little bit. I guess we're still going to be in joints, but now, did you say Dr. Hasty does the PRP protein platelet rich?
My son, Clay.
Clay does.
Yeah.
Okay.
And that's where you actually take some of a person's own blood, spin it down, use the plasma, which has a lot of the growth factors and platelets, and inject it into an area that's inflamed. They also use it for knee arthritis, and it's shown to be pretty successful. It's like everything else. I tell people everybody's not going to get results, but a lot of people do.
Right.
But it is right now not, as far as I know, not covered by insurance, and it's expensive.
Yeah.
And when you tell somebody it's going to be $500 or $700 versus, a friend of mine got a cortisone shot for a tennis elbow, and it helped him. I'll just get a cortisone shot.
Yeah.
So,
Yeah.
but it is another option that we have in our practice if people desire to, to look at that.
I would definitely do that.
Yeah, well, you said you had
I had it done with one knee, and if I have knee problems, I'm going right to Clay and say, put that PRP in my joint. But I've had it and I've studied it and I've done it myself, so I know the benefits of it, and I'm a big proponent of it.
Yeah.
And it is unfortunate that insurance hasn't quite caught up yet to the benefits of it.
Well, the funny thing about it is everybody's heard of the gel shots, or as you said here, what's
the
the
rooster shot? Yeah.
Well, the insurance companies cover that. And there's some studies show that the PRP is as effective, or maybe a little bit more effective than that. So you wonder why
They won't.
they haven't covered it. And you're taking the person's own blood, so you don't have to worry quite as much about some reaction to it.
Right, rejection.
Yep.
It just assumes it right in and takes
Correct.
care of it. So what is the rooster shot or the gel shot? What is that formula?
Well, it came out, and it's a series. So you can give 1 shot or 3 shots. Some people give 5 shots, but it's a fluid that kind of lubricates the joint. It's really only approved for the knee.
Okay.
Now, I think they're looking at studies for the hip and other joints, but it's only approved for the knee. And I tell people when they want to consider it, I said, obviously you should try it, because if it helps, and it does help about 60 to 70% of people, I think it helps people if they have a milder arthritis than if they have severe arthritis.
Right.
So I think the numbers are higher for people who have mild arthritis, whether they're probably a little lower if they have severe arthritis.
Right.
But it lubricates the knee, and if it helps them 6 months to, longer, they can, put off the knee replacement for a little longer.
And you said they could have up to 5? Is that
Well,
right?
it's depending on what company you use, and because
Okay.
there's a lot of different companies. You got
Yeah.
Synvis, you got Uflexa, Orthovid. Everybody has one now.
Right. And then, how long have they been around? About 10 years?
At least that long, yes. Yes.
And the cortisone shots, they've been around at least 30 years and probably longer than that.
They've been around a long time.
Yes,
Yeah.
and I think that they are effective for certain.
Oh, yes. There's a lot of people who for some reason can't have surgery for medical issues or for other reasons, and you give them an injection and it helps them 3 or 4 months, and they come in and get another shot of a steroid, and it does help them. Now, eventually, they're not going to be quite as effective because the arthritis with time will get worse.
Right, of course.
But it's a very effective thing, and it also helps, people who have bursitis and tendonitis. So we use it quite a bit in our practice.
Yeah. We had a provider, he was a PA, John Lucas, he's not there anymore, he's in Wilson with Ashley Parker, but he did a lot of those injections,
Yeah.
and he loved them. That was kind of his thing,
Well-
He should have worked in an orthopedic office.
Well, when they work, people come back and say that was a miracle shot,
Yeah. It's really interesting, very interesting. So, if you don't mind, let's just talk a little bit about Ashley Strickland and back surgery.
Okay.
Is there, what's the defining point of Ashley can handle this versus got to go to neurosurgery?
Right.
Tell me the difference.
Well, obviously, the first people who came out were the neurosurgeons who did a lot of the spine surgery. But then they started finding out that they needed instrumentation, infusions, and so then the neurosurgeons worked in collaboration with the orthopedic surgeons.
Oh, okay.
Like the neurosurgeon may do all the decompression and freeing up the nerves, and then the orthopedic surgeon would come in and do the fusion or instrumentation if they had to put screws or plates. Now the training is so advanced that there's not a lot of difference. If you have a back problem, if you see Dr. Lindsay Tyler, who's our neurosurgeon in our office, or Dr. Strickland, they both are able to do the same type of work. And sometimes, so there's not a lot of difference now between them because they have evolved where both areas can
Wow.
cover it.
That's amazing,
So
isn't it?
Dr. Strickland trained up in Maryland, and he does phenomenal work as far as instrumentation on the neck and the spine. So we're, like I said, we were very fortunate when he
Yeah.
came to town.
I don't want to have him in my body either. I don't
Well,
want Dr. Hasty. I don't want Dr. Strickland.
Well, unfortunately, about 70% of people sometime in their life are going to have back problems.
I have.
Or back pain.
Lindsay Tyler did a discectomy
Yeah.
on me several years ago, so.
So it's not unusual to see people, and then as they get older, they definitely have, more
Oh, yeah.
degenerative disc and spinal stenosis, and the good thing about it is, I think Dr. Strickland is not somebody that's going to go in there. If he does not feel like his surgery is going to make you better, he's going to be honest with you and tell you up front.
I've heard that. People have told me that.
And I can't tell you how beneficial that is to a person, because a lot of times, and I do know a patient of mine who was a doctor here, who had a back problem, who I told him, I said, look, where would you start and where would you end on your back because you got so much arthritis? Well, he ended up having one surgery, and he didn't get better. He had another surgery, it didn't get better. And then he had 3 surgeries, and then they said, well, there's nothing you can do, and then you end up taking, going to a pain clinic to take pain. So the wonderful thing I think about Dr. Ashley Strickland is, if he can help you, he's going to tell you that with surgery. But if he does not feel like he can help you, he'll also be honest
Right.
and tell you that.
So him and Lindsay Tyler work together in
What-
certain cases if they need it both, or?
I think they probably have worked some together, but most of the time they do about the same thing. So,
Yeah, it's one or the other.
That's right.
But is she in your office or in
She-
the same building?
she's in our office with us in
Okay.
the same building.
Okay, all right. You got quite a party going on over there. I'm gonna have to go visit one of these days.
Well,
You serve lunch?
we've outgrown our facility already.
Oh,
So
have you?
yeah,
And now
so-
you got somebody else coming, so what, y'all
yeah,
gonna be moving?
well, there's talk about us getting a new facility, yes. We're, I think that will be down the road, yes.
Yeah, awesome.
Yep.
That's right. All right, it's time for our next break, so we're gonna stop, and then when we come back, we're gonna, I don't know what we're gonna talk about something, that's for sure. So don't go away, watch our sponsors, and we'll be right back with Dr. Greg Nelson. Don't go away.
When Jay arrived at the emergency department with a hernia, he was in pain, scared, and unsure of what would happen next. That's when he met Dr. Clarice Monnier.
The way she conveyed, it was something that I could understand. She didn't talk over my head. She called me at home on her cell phone just to see how I was doing. They really treated me like family. I just can't say enough. I wouldn't be hesitant to come back here.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Well, welcome back. We've been talking about doctors that we both know, doctors I worked with, and checking out and see what's happened with them during the commercial break. But we're going to talk about sports medicine. I don't think there's many parents that don't have at least one child that plays soccer or even dance, for that matter. You can, hurt yourself that way. So, and Dr. Greg Nelson, he did sports medicine years ago when he first came to town. I remember that. And now his son, Dr. Clay Nelson, does it. So what is sports medicine? Why did we have it?
Why do we have it? Well, first of all, you're right. A lot of young people are involved with sports, from elementary school to middle school to high school and then college. And then you have weekend athletes, people who play in the softball leagues and soccer leagues.
Pickleball. You've
tennis.
seen a lot of pickleball people.
A lot of injuries in pickleball. And it's good because we want people to be active
and move
and to move and exercise. So that whole sports medicine field evolved because of that, and it does a lot of things as far as like ACL injuries, meniscus tears. They have that with the knee. You'll see people who rupture their quad tendon, which is a little older group, but patella tendons. You'll see shoulder injuries, rotator cuff tears. You'll see instability where the shoulder has dislocated or injured. So all those things were, are assisted by a sports medicine doctor.
Right.
And fortunately, like I said, my son Clay, he did a year fellowship in sports medicine and spent a lot of time with some really top-notch surgeons who do shoulder surgery. So he likes doing shoulders and he likes doing the knees. And whereas I was trained to do an incision for rotator cuff repair, he can do that through an arthroscope, which is 3 or 4 little holes.
Isn't that great?
Oh, it's wonderful on the front end. Now, I still tell people, no matter if you had it open or arthroscopically done, it still takes time to heal.
And that takes quite a while, doesn't it?
Right. And rotator cuff surgery is a very difficult operation to get over. I tell people there's a good friend of mine who played football at Duke, and then he went to Vanderbilt as an orthopedic surgeon. And I saw him at a meeting, and he came in with a little abduction pillow in his arm in a sling, and I said, "So when did you have your rotator cuff repaired?" And he had it about a month earlier, and then I saw him the year later at the same meeting, and he was doing his exercises, And he says, you guys got to tell people it takes at least a year to fully get over this. And he's he obviously played football in college, so he's a pretty tough fellow. But rotator cuff surgery and most of the surgeries that you can do on the shoulder now can be done arthroscopically, and that's what he spent a whole extra year doing.
What is it about the rotator cuff that takes so long to heal? Is it the position? Is it the use? I mean, we use our shoulders eating,
Right.
you know.
Well, obviously, traumatic events can cause rotator cuff tears,
Mm-hmm.
but about 20% of people over the age of 55 will have a rotator cuff tear. Now, that doesn't mean they have pain, because they've looked at studies where a lot of people had rotator cuff tears but never had any pain.
Really?
But then once they get into their 60s, 70s, and 80s, I mean, that number goes up to about 60 to 70%. So when somebody comes in, for instance, my father-in-law, he called me up when he was 75 and he said, my shoulder hurts. And I said, you probably have a rotator cuff tear. He says, how could that happen? And I said, well, you probably have a rotator cuff tear. Well, he's never going to believe his son-in-law.
Of course not.
And he went to Duke, so he had to go to Duke. And he saw a sports medicine guy there who sent him for an MRI and told him he had a rotator cuff tear. And he said, well, my son-in-law told me that over the phone. And he didn't charge me $2,000 for an MRI either.
Right.
He said, well, what are we going to do about it? He said, well, when does it hurt you? And he said, it hurts me when I'm throwing the ball to my dog. He said, well, throw it underhanded, if that's the only time it bothers you. But a lot of rotator cuffs will bother them all the time, especially at nighttime when they're trying to sleep, so they can't sleep well. But they also have to realize that there's a surgical part of it, which getting over that and get through the pain, and then there's the recovery time and the rehab, and that's important to do, because some studies have shown if you have your rotator cuff tear and you look at their shoulders with an MRI a year later, about 20% of them will re-tear. Doesn't mean they'll still have
Really?
pain, but they could still have a cuff tear. So there's a lot of factors going into it, but it's the surgeon's part to fix it, and then it's the rehab part with the physical therapist
Yeah.
and rehab
Yeah.
and getting their motion back
Yeah.
in. And it's a tough operation, but it's 90% of the patients who have it are happy they had it done.
Wow. Yeah.
But
And is that, what's the one where you lift your hand and you can't hold it up?
That's usually a rotator cuff
That's the
tear.
rotator cuff?
Yeah.
Okay, yeah.
Because there's 4 rotator cuff tendons in your shoulder that go around the shoulder, and so it's a pretty common problem. And then also you see a lot of people injuring their ACL, their anterior cruciate ligament,
Oh, yeah.
and that's where people go in and do the surgery and fix those as well. And we're lucky to have him, because when I came, I mean, I'd been trained to do those things, but now you can do them with such minimal incisions
Yeah,
and
yeah.
arthroscopically, and it helps them on the front end as far as getting through it. It's still difficult with pain after surgery, but that pain will get better. But doing the therapy is really important. That's
Yeah,
where you have to
yeah.
have your physical therapist
Yeah.
colleagues to help out
Yeah,
a lot.
Yeah. Physical therapy is almost a miracle. I'm being serious,
it-
I mean, people come in with back pain. Well, of course, what do? You send them to physical therapy, and and I'm not sure the percentage, but a lot of people, that's all they need is some physical therapy. you
Well,
know.
a lot of back problems will get better with some time. And physical therapy is important for them to do, because a lot of us don't have very good posture. We
I know.
when we bend over to pick up something, we use our back instead of our legs.
Yes.
And so you do get a lot of back problems, and physical therapy is really beneficial for that, and it helps a lot of folks.
Yeah, it is. People don't believe me, and then I'll say, well, you'll probably need to go see Dr. Nelson, but we'll get some physical therapy first, and they don't want to do that. They
That's
just
right.
want to go right to Dr. Nelson, and they want to get Dr. Nelson to fix everything, and I'll say, okay, I'll send you to Dr. Nelson, but he's going to send you to physical therapy.
Well, sometimes you have to send them to therapy. even bef-
Insurance-wise.
For insurance purposes too, which I'm not sure I'm totally in agreement, because sometimes people need an MRI first.
Right, that's
And then
right.
there's other that therapy could be beneficial first. But when they say, they got to go for 3 weeks or 6 weeks of therapy, that does help a lot of people, but there's some people who need that MRI done earlier.
Yeah. So let's just talk about pickleball, because I hear a lot of people, well, I was playing pickleball and I hurt my arm, I hurt my leg. So what are the injuries that you see from that? You see a lot of them, don't you?
Oh yeah, you see a lot of, and pickleball is one of the fastest growing sports in our country.
I know.
Because it's one of those sports that, as I tell people, you're getting in your golden years. If you want to stay active, it's a sport you can play. And we see a lot of trips and falls. You know, Dr. Hastie's fixed a lot of broken wrists.
Has he?
He's fixed some broken
You fall and
ankles.
you go like
That's
that.
right. So he's fixed a lot of those. And we've seen, you know, other injuries where they do rupture a quad tendon in their knee or a patella tendon. But it is a lot of injuries in pickleball because there's so many people now playing it.
You think that's what it is? It's the number of people playing it?
It's a huge number of people
Yeah,
playing it. And the other thing too is, you know, people go out as we get up in age, you need to warm up a little bit more.
Yeah,
You know,
yeah.
and a lot of us don't have a lot of time, so we just walk out on the pickleball course
Start doing
and
it.
start doing it without warming up, and that leads to injuries.
Yeah. That would be me. I've been kind of thinking about it. I've got several friends who say, come on, Linda, let's go. But I stay so busy that's, and I exercise every day, but I exercise in the morning.
Right.
I'm a morning girl, so, you know, I like to get all that done before I even get to work.
Well, it's hard to get people to think about exercising, especially when something hurts. But studies have shown if you exercise, in your brain, it produces endorphins, which are some of them say are stronger pain medicines than morphine.
Right.
So it does help pain to a certain
Yes,
degree.
yes.
But it definitely helps strengthen up your muscles. Because I can tell you, and I'm one of them, you know, I used to get out of a chair just easy. Now I have to use my arms a little bit to get out of the chair. Or if I'm down on the ground doing some work, I got to find something I can kind of crawl up on. So, but that's just a part of aging, you know. And as I tell people, I can do your knee replacement, but you still may have to crawl over to, you know, unless we get all that strength back.
Right. that's
Because
right.
we lose some strength as we get older.
Yeah, and it's really important for us older, but for everybody to exercise. We're born to move. I mean,
That's
God
right.
made us to move.
That's exactly
And
right.
sitting on that couch, you know, they say now that's the new smoking. And of course, like we were talking earlier, people and adults are just as bad as kids when it comes to this kind of thing.
Yeah, I think one day we'll learn that we use those way too much.
Yes. My friend I see, he's like, put that phone down, Linda. So we kind of have to, and I'm bad. I'm pretty addicted to the games. That's what I'm addicted to. But it just relaxes my mind,
Right.
you know.
Right.
So I do that just to.
Well, it's like everything else,
mindless activity.
in moderation,
That's exactly right.
you know.
Anything in moderation.
Correct.
Yep. So we got a couple minutes left. Is there anything you want to, and let's just talk about each one of the docs in your office and, you know, give a shout out. Where is your office? Who do they call? How do they make an appointment? Do they have to have a referral? What?
Most of the people we see do not require referral. Some insurances do, but you can check with the insurance. Our office is behind the hospital, so if you go into the hospital where the big fountain is, and you take that first right, and you just keep going all the way till you get to the very back, and you'll see our office there. And like I said, we have Dr. McAvoy, who, like I said, was not only my partner but my friend, and I mean, for two people to come together and be together as much as we have been for this long, it's been a good marriage.
Yeah,
you know?
that's right. You
But
probably spent more time with him at times than you did your
That's
own
right.
wife.
But he did a fellowship in Charlotte with Total Hips and Total Knees, and he is very active and still doing a lot of hips and knees for folks.
Is that mostly what he does then?
That's I would probably say that's 95% of what he's doing now.
Okay.
Yeah. And then, like I said, if you break a bone, no matter where you are, you need to come to Rocky Mount and see Dr. Hastie, because he does phenomenal work in putting bones back together. And he loves doing it. that's the thing about, he loves
Well,
to do it.
that's why he's so good at
That's
it.
exactly right.
Mm-hmm.
And then you got my son Clay, who enjoys sports medicine, and I've told him I can help him out some, because when sports starts getting started, like in
He's gonna
football
be
season,
busy.
I mean, you getting coaches calling you, therapists calling you, trainers calling you. Sometimes they got to have some time to see patients. So I've told him, I said, turn some of that over to me, and I can kind of help you along with that. But he's highly trained in doing all these sports medicine injuries and doing them arthroscopically. And of course, him being my son, I'm obviously be a little bit biased, but
Well, of
I feel like
course.
he's as good as anybody I've seen trained. And I have gone in and watched him do surgeries that I have watched videos, and he does them just as well as the videos do them.
Oh, awesome.
And then
And he looks like you. He's a handsome guy like
no,
his dad.
he's a lot better. He's a lot better looking guy than I am. But and then the other Dr. Ashley Strickland, and I said the thing that's wonderful about him is if he can help you with back surgery, he's going to tell you that. But if he cannot help you, he's also going to be honest and tell you that. And that's a big thing for a surgeon,
Yeah.
because
that's
they
right.
do like to operate.
Right.
And when somebody tells you, who's a surgeon, that he does not feel like surgery is going to help, it may not be what you want to hear, but it's probably the truth. And that's the thing that's wonderful about him.
We don't always want to hear the truth, do we?
Sometimes we don't.
No, that's right, we don't. All right, well, it's time to say goodbye. Thank you so much for coming. I
Well,
really
thank you for
appreciate
having
it.
me, and,
It's been a long time since we worked together in
We-
the ER 100 years ago
we
when
did
he was
do a
on
lot-
call.
we did
but
do a lot of
we
things
did,
together.
That's right. All right.
Thanks for having me.
It's good to have you. All right, we will see you next week with more of Here's to Your Good Health. Good night. Thanks for watching.